You're listening to Plants and Politics with Gina Bonanno-Lemos. If you're ready to hear the truth about both sides of the aisle, what's really going on in America, and how big money interests prevent change to keep you sick, broke, and desperate, then play on. Hello, everyone. Welcome to Plants and Politics. This is Gina. So I want to share a pretty exciting, very interesting study. The National Institutes of Health funded a study, and it was led by scientists at the University of Chicago. And this was a nationwide study. What they found was that a person's composition of their gut bacteria is related to the existence of specific brain lesions called cavernous angiomas. So what they found, and this is a direct quote from the study, they found that the presence of abnormal bundles of brittle blood vessels in the brain or spinal cord called cavernous angiomas are linked to the composition of a person's gut bacteria. So this is a pretty important finding because these cavernous angiomas are lesions, and as they describe it, they contain slow-moving or stagnant blood, and they can cause strokes, seizures, and headaches. So obviously, very important because people who have strokes, often the first sign that they have any kind of issue is the stroke, and often it's fatal. So here's how they conducted the study. They compared the stool samples from 122 people who had been confirmed to have these cavernous angiomas based on brain scans. And then they had a control group of participants who had no lesions. And the two groups were matched for age and sex. So what they found was that there was an abundance of 3 specific types of gut bacteria in the patients who had cavernous angiomas as compared to the control group. And this was regardless of the person's sex, where they lived, or even their genetic predisposition to the disease. So in other words, the people who have these lesions in their brains had 3 specific types of gut bacteria that the patients without the lesions did not have. What they also found was that the participants who had these lesions had far more gram-negative bacteria in their gut. Now, these gram-negative bacteria are pretty problematic. There's been studies done, and the National Institutes of Health have also talked about how they pose a very high health risk because gram-negative bacteria are highly resistant to antibiotic treatment. So it's the presence of gram-negative bacteria puts you at risk of likely ending up in the ICU. And if you have some sort of infection, it will end up being a life-threatening situation because you're unlikely to be able to be treated with antibiotics. Your body just won't respond due to the presence of this gram-negative bacteria. So it's very dangerous. What they also found is that the participants who had these cavernous angiomas, their stool contained more of a molecule called lipopolysaccharides. Now, lipopolysaccharides are known to cause internal inflammation, and they noted in the study that they've also been found to cause the formation of cavernous angiomas in mice. So very, very important findings. The study went on to say, and this is a direct quote, further analysis showed that some gut bacteria compositions could identify aggressive versus non-aggressive forms of the disease, as well as those with recent symptomatic hemorrhages. So just by looking at their gut bacteria, they could tell whether the person had a very serious and life-threatening form of this disease, of these lesions on their brain, versus ones that were like, okay, they're there, but they're not as serious, right? Maybe the people who had headaches versus someone who was about to have a stroke. So really huge findings. Currently, the only treatment for these cavernous angiomas is surgical removal if they're located in a place in the brain where it's safe to remove them. Obviously, if you can control the formation of these lesions or even prevent the formation of these lesions by manipulating and changing a person's gut bacteria composition, that would be huge. If you can prevent somebody from having to undergo brain surgery, I mean, that's unbelievable. And as always, as I always say, the best way to create a healthy microbiome, to get your healthy and unhealthy gut bacteria in balance, to end up with more of the healthy than the unhealthy, and to promote the growth of the proper species, the healthy species, and to also get, to have a really healthy microbiome, you want to have as many species as possible, not just the one or two that are sold in probiotics. There should be a multitude of species in someone who's very healthy. So, best way to do that, eat a plant-based diet. Also, prebiotics, probiotics, which you can find in food, things like flax seeds. Also, eat a lot of fermented foods. That's going to help you as well. So, hope this was as interesting for you guys as it was for me. I'm kind of a nerd with this kind of stuff, so I find it fascinating. Anyway, as always, like, share, subscribe, all that good stuff, and I will talk to you guys soon. Take care. Thanks for listening to Plants and Politics. The only way we can take our country and power back is to spread the truth and build an army. So remember to like, follow, subscribe, and share on Facebook, YouTube, and wherever you listen to your podcasts. Thanks again.